Good afternoon, good evening. It's time for the Daily Briefing on KLAM and KCDV. It's Wednesday, April the 22nd, and this time we are visiting with Mayor Copeland. And he's going to tell us about a little bit about primarily the new website that has just launched for the city, which everybody is hoping it will be a very valuable tool for people to get the information that they need. And specifically, in addition to the website in general, we're going to focus on the part that explains the new masking rule. How starting tomorrow morning, there's a new requirement for wearing cloth face coverings in public. Now, if you want somebody else to be able to listen to this that maybe didn't catch it on the radio, if you want to point it out to them, direct them to our Cordova TV YouTube channel, youtube.com/Cordova TV. This show will be archived there, and our daily briefings, as I'm sure you know, air in the 1, 5, and 8 p.m. hours. So let's start our visit with Mayor Copeland here on the Clam and the Eagle. Mayor Copeland, nice to have you with us as we're speaking here just prior to the start of your noon meeting. Obviously, there is some urgency to move it along, and the big topic right now, obviously, is the new order for masks. So run us through that one.
Sure. So I'll just again reference the brand new website that the city posted Monday afternoon this week, and that's COVID-19, all one word, COVID-19.cityofcordova.net. And if you still go to the City of Cordova's main webpage, the link there will take you to this new website, which is so much more user-friendly and easy to navigate. But on that website, if you go to News and Rules at the top, click on that, you'll see that the latest thing in the news is the face covering requirement, which goes into effect at 8 o'clock tomorrow morning. So one of our PIOs, Public Information Officers, Kathy Renfeld, pulled up some CDC guidance because we know that the questions will come rolling in. So I just wanted to go through a few of these CDC guidance items on cloth face coverings. First, you want to make sure that your face covering covers both your nose and mouth. Second, you want to make sure that you don't remove your face covering until you get home. And when you do remove it, try to avoid touching the front of it because it could be contaminated. So you want to remove it by grasping the ear loops or ties or the externals and immediately discard it or put it in your laundering container. Third item is you want to wash your hands immediately after removing your face covering and before you touch anything else because, again, you may have got contamination from the mask. And then you want to launder your face covering in hot soapy water between each use. So I know locally for myself, my wife has sewn several of these, so I just have ones that I can rotate. I'll wash a couple and have them drying, and then I'll grab a clean one, and when I get home, I'll throw it in the hot soapy sink. So another item from the CDC is that homemade face coverings are just fine to wear, and they're actually preferred because N95 and surgical type masks are desperately needed by our healthcare workers and first responders. So the last point is that you shouldn't be relying on these face coverings as the primary way to prevent transmission. And you want to be careful to develop kind of a false sense of security by using these face coverings. You want to continue following your social distancing, including maintaining your 6 feet of separation between you and others, and stay at home and avoid touching your face and washing your hands frequently. Those are still the best tools at our disposal. What the cloth face covering does is it helps a cough or sneeze to propagate through a public space or onto other surfaces or other individuals.
Right.
So I hope that helps provide some general guidance, and these will end up on the website soon.
Yeah, well, and I would emphasize, too, exactly what you were saying, that people shouldn't think that because they're wearing a mask that makes it, say, safer to start going out more or to start getting closer to other people not in their household. It's the system is going to backfire if people start thinking that. You should still move around or not move around, really. Stay at home, number one, social distance if you must be out, and do those things as if you didn't have a mask. The mask is just a bonus. So you said, and I've seen numerous doctors and other professionals saying, don't feel emboldened to change social distancing behaviors, right?
Exactly. And then just to kind of wrap up on the masks, the rules actually require that you wear them in public spaces in the community. So when you go into buildings and so forth, and then in the harbor, because in the harbor you have a lot of narrow ramps and so forth, and it's really difficult to maintain the social distancing. And then in general, any places, public spaces where you can't maintain 6 feet of social distancing. So if we still had phone booths around, obviously, if you try to cram into a phone booth with someone else, you better have a mask on, right? So
sure.
A little common sense there.
Sure.
But so that's the masking rule.
And I'll go over the language of the emergency order on this after you and I are done to wrap up the briefing here. But what do you think of the website, kind of in general? What are some other key things you'd like to point out about this new site?
Well, I think it's so much more user-friendly. If you scroll down, if you go back to the homepage, right across the top is a great dashboard. Like right now, it tells us we have 0 positive cases. There have been 16 individuals tested in Cordova, and there's 1 awaiting results. So 15 have come back negative, 1 is awaiting results, and we have a total testing capacity now of 920. So as you scroll down a little farther, you get into these great functional blocks that are really easy to access and really specific. So there's one for Cordova residents, for instance. There's one for quarantine basics. And then there's one that kind of highlights another recent development, and that's fishermen and other businesses. And as the Cordova businesses who are required to file their mutual aid agreements work on theirs, we also think about the fishermen arriving to town. And so if you click on that fishermen and other businesses, it takes you to a page, and it has a bunch of frequently asked questions on the right-hand side. So if you go to the first one, or their special rules at the harbor, and click on that, it has the harbor COVID operations plan posted there. So this is the new operations plan. And so without getting into too many of the specifics of the harbor operations, I just want to emphasize, and this is kind of true of the masking and all the requirements, there's been a lot of public emphasis on what is the city doing to mitigate this? What is the city doing to mitigate that? What is the state mitigating to doing this? And I want to emphasize and repeat something that Dr. Fausti said at the national level, that the way we're going to beat this pandemic is by behavior. That means individuals taking individual precautions, and we should be aware of what's going on around us and the rules, but the most important thing we can do is manage our own personal behavior, make sure that we're, again, washing hands, social distancing, wearing masks, not going out in public if we don't need to, and minimizing our contact, even at home. And as we bring things into the home, make sure that we're sanitizing and protecting ourselves, because the best way to keep from getting someone else sick is to make sure that we don't get sick. And that slows the spread and keeps us in the relatively good position we're in right now. So regarding the harbor plan, it says working document on it. I know that there are others in the community who want to contribute, have considered alternatives. The city's taken a look at some draft plans by others, looked at the feasibility of incorporating all or some of the elements. Many of them aren't workable. Don't feel bad about that. The city does not want to discourage people to continue submitting good ideas and recommendations, and just submit those through this website, through the cordovaprepared@yahoo.com email address. And we are very much appreciate and need, frankly, the volunteer help and the suggestions we're getting from the community to really put and keep ourselves in the best position we can to manage this pandemic.
Okay, well, Clay, obviously we're up against time, so I want to let you go. Again, I'll go over the new masking rule here myself afterwards, but sure appreciate the time. Anything else, or did we pretty much cover it?
No, we covered it pretty good. Looking forward later this week maybe to some discussions about mental health and some resources here in the community that can help you manage, some of the emotions and challenges of the psychological side of this pandemic later this week.
Okay, sounds great. Thank you again for the time. So as we let the mayor go here, just briefly, and if you want to hear, by the way, the more extensive examination of the face covering rule, we did that this morning on the talk show and included the city manager's statement about it. That show is available on our Cordova TV YouTube channel. So go to youtube.com/Cordova TV and you can hear more detail on this, or again, take a look at this new website. But what the rule says, effective at 8 a.m. tomorrow, all individuals in Cordova must wear a mask, bandana, or other type of cloth protective covering over their nose and mouth when entering a building open to the public, the harbor, on docks and ramps, when pumping gas or using gas station amenities, and in any other settings where social distancing of at least 6 feet is not possible. Individuals under the age of 4, individuals with trouble breathing, and individuals with a medical condition that prevents them from wearing a facial covering are exempt from this rule. All individuals alone in a space requiring facial coverings under this rule are not required to wear a covering unless and until another person outside that person's household arrives at their location. And the website also points out that anybody in need of a face covering can submit a request for a local handmade cloth mask. People have been doing this for each other for weeks. There have been different Facebook groups and so forth, and I get the sense that the IMT is coordinating that. So if you need one of these, there's an online way to submit a request. And remember again that masks won't help if the more important rules for slowing the spread aren't followed. So the absolute best thing to do is to stay home as much as possible. If you have to be out for something essential, be sure you don't get within 6 feet of anybody. And on top of that, if you have to be out while you're staying at least 6 feet away, wear one of these masks. But it's very important that folks don't feel like because they have a mask, now it's okay to go out more, or now it's okay to not stay as far away from others as possible. And again, we cover this pretty extensively in today's talk show, which is available on the channel, youtube.com/Cordova TV. So that will wrap things up for today's daily briefing, April the 22nd. Again, if you missed any of this, it will air in the 1 p.m., 5 p.m., and 8 p.m. hours today. It's also available for listening to online and sharing with others that you think maybe would want to be able to hear it for some reason via our YouTube channel for Cordova TV. It's a companion to our Cordova radio operation, our main operation, and you can get there by going to youtube.com/Cordova TV. Thank you again for listening. We'll get regular programming back underway now on The Clam and the Eagle.